name's Ellie and I'm 20 and I'm a first-year medical student at Anglia University.
My name's Albion, I'm 21 years old and I am a biomedical sciences graduate, currently a first-year medical student at Anglia Ruskin.
As you'd expect with a course like medicine, the days are quite structured from Monday to Friday. They exist in quite a rigid timetable and we've got to sort of fit in and do what we can in between times.
My typical week at med school consists of lectures Monday to Friday from 9 to 12.
I head over to the med school just before 9 and then we spend 3 hours worth of lectures from 9 till 12 with 3 morning lectures.
And then in the afternoon there's a number of different things we could be doing. So for me currently, for my cardiovascular block, I'm on hospital placements in the morning.
We have a day of placement, an afternoon of placement, an afternoon of clinical skills, an afternoon in the super lab, and then an afternoon of SML, which is student mediated learning, which is our chance to go away and revise things we want to revise or do our own thing.
The time management needs to be good, and the university gives us, we have the Wednesday afternoons off. So you do have that time as well as the weekends. And it just sort of depends on the type of person you are.
And you're at university. University's meant to be fun.
Yeah.
I think you can't get bogged down in work, because it doesn't become enjoyable. And I'm here because I want to be here and I want to enjoy it.
There's many things that we could be doing in our afternoon sessions. One of those things is clinical skills. Our clinical skills work is usually done in groups or in pairs, and it's actually really useful because we learn about a lot of things in lectures and it really helps bridge the gap between the theory that we learn and the practice. The SAM unit is a really clever piece of technology which is able to simulate breathing sounds, heart sounds, abdominal sounds that we might hear when on practice or on placement to either our hospital placements or at GP. We can listen with our stethoscopes to hear for normal breathing sounds, normal heart sounds, normal abdominal sounds. It's a really nice way for us to hear these things firsthand before we actually go and hear them in patients. You find out really quickly that one of the most important parts in medicine is actually communication and understanding what your patient is saying to you and what their problem is so that you can make an accurate diagnosis and treatment plan. And this is something that we get a lot of training towards. And then there are sort of associated diagnostic procedures that you can go through, such as taking a blood pressure, auscultating or listening with a stethoscope, percussing, palpating. And these are all the things that we get to practice and learn in our afternoon sessions during our clinical skills workshops.
We use the Super Lab to partake in a range of different experiments during our degree. For example, we use it for pharmacology practicals. So recently we were in there looking at aspirin and paracetamol and working out the amount of active drug in each compound, just to give us a bit more relevance into the real world application of our degree. For me, resilience is a huge one.
Yeah.
But I think to have got into med school, you're going to have a huge amount of resilience because the process is so difficult.
I think I completely agree, and I think another one is you have to have an adaptable revision method. I think the biggest mistake is to assume that the revision methods you used at A-level can somehow be applied to medical school. Although some of them are applicable, most of the time you find yourself just as much time as you're spending sort of learning the theories, you're actually spending as much time learning about yourself.
You've got to be committed.
Yes,
If you want to do it, you've got to embrace it fully.
Yeah.
And with what you're saying about the revision, I think it's totally right. Like you can't do like A-levels, you can't come here and learn everything. There's so much syllabus. You've got to learn smart with medicine. Has placement changed your viewpoint or anything at all? Are you enjoying it?
Yeah, I mean, placements have been amazing. It's a really good way, as I said before, maybe to bridge the gap between lectures and the practical work we do at uni, and then taking that to either our hospital or GP placements.
I feel quite privileged in many ways, especially with the GP placements, because you're let in so close to what they do. You sit in with them for all their patients, as long as the patient's happy, of course. And it gives you a real insight. And actually, I think it's made a lot of us see that being a GP would actually be quite a good career. And that's nice, because that's what we're here the recruitment is for, the drive currently is for GPs.
And we do so much work on like communication and building up a good doctor-patient relationship.
Yeah.
I feel like that's always more
soft
applicable.
skills sort of thing. Yeah,
and it's always more, I think, always more applicable in the GP settings. Obviously, also important in the hospital settings. But when you have a GP clinic and when you're working in a GP clinic, you've got
that rapport, haven't you? Because you know the patients quite well, and I like that.
That's exactly why we do the placement as well, to understand the reality of it and not just, not just listen to what other people have said or the general stereotypes about it. It's really good that we're there, and even from first year, so that we can make a more, a better judgment. Informed
decision on it, totally.
Exactly.
And like, I think also like with the hospital placements, we're so lucky to be able to put in our clinical skills into practice.
Yeah, that time is so invaluable and it's so helpful in every context, because you have someone who is incredibly overqualified relative to us, and giving us all their knowledge and their experience, and then we get to take that on from first year. I think that's it's been one of the most appealing parts of the course for me so far.
I think on placement you've got to be like a sponge.
Yeah.
You got to just look and learn and take it in.
That's it.
Right, opinions on the Cadaver experience. Was it all positive? Were you apprehensive at all going into it? Because I was,
Naturally, I think I had curiosity and apprehension was definitely there before I started. And I think the good thing was that before we even did anything with the cadavers, we had the get to know your cadaver session where we sort of just looked at them and understood what it was like.
That really helped, because I was quite nervous about it. I wasn't sure what to expect.
Absolutely. And the fact that they are embalmed in Thiel.
It's so good.
We're only like the second university in the UK to do that at the moment.
Yeah.
Like, it's unbelievable just how much of a studying tool they can be because of that.
It's amazing, and we're so privileged, but it is not a normal experience.
Yeah. It's not an everyday experience, absolutely. Yeah. But from an educative perspective, it's invaluable. And what a gift, what a gift from all those who were generous enough to do it.
It's an amazing gift, actually.
Yeah.